Welcome. I am Lucinda Curran, your host for the Environmental Sensitivities Symposium, a world-first event. And today I have the pleasure of introducing you to Dr. Braham Rabinov. Dr. Rabinov, could you first of all tell us about the work that you do and how it's related to environmental sensitivities?
Yeah. First of all, I'm an integrative medical practitioner where I combine standard general practice medical care with evidence-based nutritional and environmental care. In other words, I take a holistic sort of approach.
How did you come to do this work? What was your journey from, mainstream medicine into the integrative approach?
Yeah. Well, as a GP, I was very happy when I came to treating acute medical problems like heart attacks, acute asthma, bleeding ulcers, and that was very effective. But then I had a large number of patients who had chronic conditions and who also asked me about any possible underlying causes about prevention. And it was because of these conditions that I started to look into what the possible causes were and found that amongst other factors that many cases they were triggered by environmental sensitivities. And if I give you examples, it can be headaches, migraine, cognitive, mood and behavioural dysfunction, unexplained tiredness and energy depletion and sleep disturbance, rhinitis, hay fever, mouth ulcers, eczema, skin rashes, hives, joint aches, irritable bladder, and also the irritable bowel syndrome or irritable bowel.
And I can imagine that going into things in this way and exploring, more so for the causes, it really changed the way that you practiced as well.
That is right. So I like to look in breadth and I like to look in depth and look at triggers and underlying causes.
That's fascinating. And so what makes you so passionate about working like this?
I think that what really gets to me is the fact that you can help so many people. It requires a lot of energy, a lot of time, but the reward for the patient and their families, if you improve them, is enormous.
So what sort of differences would you see for them?
Well, many cases you can modify the severity of their illnesses. You can even, in many cases, prevent the illness or prevent their recurrences. No matter which way you look at it, patients can only be better off or the same. Rarely are they worse as a result of this approach.
That's brilliant, and I'm guessing too, because of the work that I do too, that you'd be seeing the same thing, that the quality of life is so different for people once they shed the symptoms.
Quality of those people and for their whole families. And often there's an economic burden with all the health costs that are associated with it.
That's interesting. So going back to when you started practicing as a general practitioner, how long did you work in that way before you sort of started looking at this more in-depth approach?
I'd say about 10 years.
Wow.
And I've been doing this work for about approximately 30 years.
That's fantastic. And you've done a whole lot of extra training as well, haven't you?
Yes, I trained. I'm a fellow of the Royal Australian College of the Australian College of Nutritional and Environmental Medicine, where I did most of my training, but I've done a whole lot of other training in other nutritional and environmental areas as well.
That would be fascinating. Could you tell us a little bit more about those?
Yes, I've made a whole interest in most of all the nutritional areas, and I've also, in the allergy intolerance, I've been to England, I've been to Breakspear Medical Centre, which was one of the first centres in the world that dwelt on this whole area of environmental toxins. And I've been there twice to learn and to be brought up to date with what's happening, and also about the tests that they do, their treatment as well.
I think that would be one of the most remarkable experiences, going somewhere like that where they specialise.
Yes, it was fascinating, and it made me even more motivated because I feel my understanding and my effectiveness has increased as a result.
That's brilliant. And I guess with the sorts of people that you see as patients in your clinic, would you say the majority of them have some sort of underlying environmental sensitivity as well as what they're presenting with?
Practically everybody in the end has an underlying cause to their condition, and it's generally accepted in medicine these days. One of the commonest factors is the food we eat. And if we take the food, it's now been found there are many factors regarding our food allergies, food intolerances, and so forth, that play a big part in our gut and in our general health.
Have you noticed a change in all the years that you've been practicing in terms of those food-related conditions as well? Because I guess when you look at what's happened to our food, a lot of the food on our tables throughout the world is now genetically modified. It's treated with pesticides and herbicides and all of that. Have you noticed changes with all of that?
My general impression that the area of allergies, intolerances are generally increasing. And in fact, there was a trial or survey done at the Royal Children's Hospital, I think it was about 2 years ago, where they found that the allergies in 1-year-olds had increased very significantly. So there's surveys showing that allergies have definitely increased in our community. The issue of the intolerances, there's been one of the biggest intolerances are the sugar intolerances, and they one sees those a lot in irritable bowel, and these days 15 to 20% of people suffer from irritable bowel. Approximately 10% of GP consultations relate to irritable bowel. Approximately 50% of gastroenterologist consultations are for irritable bowel. And what's been found through the work of Professor Peter Gibson and Dr. Sue Shepherd is that in large numbers of cases, this is related to the food that we have, and it can be related to sugars and to non-sugar items.
That's interesting too, because I think in the last at least 30 years, our intake of sugar has just skyrocketed.
Yes, well, I think, if you look back, we're made for whole foods and not processed foods. And what has happened is our food has become, through agriculture and business, has become more and more processed. And with it, we are getting more and more refined foods, refined sugar. And if I take the extreme, sugar has no vitamins and minerals in it. And refined foods have reduced nutrients in them, and on top of it, reduced fibre. And it is thought that fibre plays a very important role in damping down inflammation in the gut. So we've got this whole background and mismatch that is leading, I believe, to the increase in allergies and intolerances. On top of that, we've got the situation that the sugars, which come from sugars per se or from the breakdown of starch into sugar or from other substances that may be in our diet, some of it passes down into our large intestine where the bacteria sit, and they encourage harmful bacteria. So we get a dysbiosis or imbalance of our gut flora. And that imbalance and those harmful bacteria can cause harm in themselves. And then on the other side of the coin is there might be a suppression of the good bacteria, which help with calming down the immune system. So it's a whole theme, but the whole theme really goes back to we've shifted from whole foods in a clean environment to now processed foods in environment that is not so clean, and where in many of the foods that you buy, there are added chemicals. And then there's the question not only of the individual chemicals themselves, but the whole interaction with them as well. And in my opinion, it's the whole interaction, the whole cumulative interaction of all these factors in a genetically prone person that in turn has contributed to this ever-increasing problem.
It's a big picture, isn't it?
It's a big picture, and it's very hard for patients because it's not just one item that is causing the problem. It's multiple factors, but what there is one theme, and I think if one wants to hold it together, the best is to think in terms of how we eat our food. So we look at the food, we look at the sensitivities in the food, we look at the toxins in the food, and then we look that when it's in the gut, what happens to the flora there, what happens to the gut wall, what happens to the immune system, which is around the gut wall, and then its effects on the rest of the body and of the mind.
It's incredible, and I guess what I really get excited about is the way that not only you've changed in your approach, as have a lot of GPs who are moving into more of the integrative medicine and understanding in the environmental medicine, but also the way that it's almost like re-educating the patients. The patient can't come just to get a pill that will fix things. It's a lot of renegotiating life and what you do.
Yes, and this is terribly important. Google has helped there a lot because patients got access to a lot of information. Though you can get Google fatigue because there's so much information and one can be unsure, but one can look for credible organisations like universities and reputable clinics like the Mayo Clinic to get information. And if one sticks to those sort of organisations, one then has got a good chance of getting reliable information as opposed to people advertising to sell their products, which tend to give bias.
Absolutely. I think that's the other important aspect. People think a few hours of research, on the internet will give them all the answers, but they'll end up with a lot of conflicting information. The biases, like you're saying, I guess unreputable information, and then they're in a bit more of a quandary, aren't they?
They can still be in a quandary, and that's why in the end one needs to get professional advice for people who are experienced in this area. The other thing we do is we run seminars from time to time to educate people because we try to distill out all the information and answer questions at the time.
That's a lovely way for people to interact and also for you to share the message sort of to a larger group in one go.
Yeah, and it's, I think, one of the most effective forms for the patient, and also because as a practitioner I'm only one person, it takes a long time to educate. It's a far more cost-effective for the patient, and also I don't suffer from Dr. Brain Drain.
Dr. Brain Drain, what's that?
That's from trying to do too much in one day.
Haha. I think we can apply that to all of the professions, can't we?
I think it applies to most people in this life.
Oh dear, that's a very nice way to explain it. But I think it's beautiful the way that you've been able to grow as a professional and offer so much more help to people.
Yes, well, that is very satisfying. And I think that, this is not only individual doctors, but there's organisations like the Australian College of Nutritional Environmental Medicine, and also there's a lot of other health professionals who are taking active interest and able to help in various aspects of these problems.
Absolutely. So everybody, Dr. Braham Rabinov will be a speaker at the Environmental Sensitivities Symposium, and you can find out more at environmentalsensitivities-symposium.com.